Let's talk ADHD, attention deficit hyperactive disorder. I think I got it right. How do you know if you have ADHD or if your kids have ADHD, or can they just be active children? Are they just sort of a sanguine, as we say, personality? They do get bored easy. I was always that guy, but I don't know. Did I ever have ADHD? Never diagnosed. Don't know. I probably wouldn't do what I do if I knew. Well, let's find out for sure. Dr. John Braccio, Regional Psychological Services in East Lansing. This kind of what you specialize is, isn't it, Doc? Hey, what's up, Doc? Good morning.
Well, it is, my friend. And obviously, when persons with ADHD, and let's talk here a little bit. We've talked before, but there are really three separate diagnoses. One is predominantly inattentive. Okay. The other is predominantly hyperactive impulsive, and third would be a combination of the three. And what we're talking about here today was really children and just how they feel in relation to their parents if they're not fully, connected. But if you're a person who lacks focus, inattentive, and this can lead to procrastination, it can lead to a lot of issues in the home. Now, we're not talking about persons who just are, have conduct disorders or are just problematic and refuse to do things. These are persons that really struggle. They really do. And when they're growing up, it's just not picked up in the home, or cannot. If it's not picked up in the home, it leads to really a lot of confusion, a lot of difficulty, because they can be seen as lazy or purposely trying to not pay attention. They're trying, if they're talked to or they're given advice or asked to do things, they're easily distracted. They easily can move off and go in a different direction. So not only do they have to deal with themselves, but which can be difficult, but if they're living in a home where even if the parents love them, if they're really not aware of this or not aware of how to deal with them, or they think they are being just trying to cause problems, then this can lead to a lot of problems. And let me just put in a non-technical way with ADHD. It's really, they're wired differently, okay, if you want to put it. And it's not that they can't focus, but they often focus on many things at the same time. And unless they have a great interest in something, we think of the kind of the statement of, well, they can play a video game for hours, or they can learn everything about a scientific principle or whatever. Well, that's because they're highly focused. So what happens is, when they can't focus, this leads to them not completing activities or having to do them at the very last minute. So it can be really just a very, very difficult thing to deal with. So, and another thing, if you're thinking about a lot of things at the same time, I talked to a woman here recently who says, Dr. Braccio, I can think about 20 things in 20 minutes, and sometimes I'm thinking about 2-3 things at the same time, and it's really can be very, very difficult, or going off in 100 different directions. And persons who have this think it's kind of normal, but the parents who, with maybe the best intentions in the world, just can't figure it out. Like, Chucky, I've asked you to take the trash out, to remember to close the door, to do this, to do that. And a lot of times these persons need, more cues. They need time. They need to be told specifically, do this and do that, and not just be expecting that they're going to remember 4 or 5 things in a row when they can easily get distracted.
So as a parent then, because if you look at genius type people, Elon Musk, all these kind of folks, they're involved in a million different diverse things. How, now I'm not saying he's ADHD, I'm just saying that seems to me to be that kind of a person. So as a parent, how do you focus the stuff? Because to me, everything you've said so far are good qualities.
Well, they are if they're under control. Remember, very successful persons can have ADHD. It's when these characteristics of lack of focus, lack of attention, procrastination, if you're hyper, impulsive, if those get out of control, that's what leads to issues. If these can be kept in place, there's a lot of positive aspects with these characteristics, because you can have more energy, you can have more time, you can work on more things, you can be more creative. There are a lot of positive things. But if you're in a home that people don't see that, they say, Chucky, he just, he forgetting to do this, forgetting to do that. The thing parents can do is try to give cues, like make the point, I want you to do this. I want you to do this in 10 minutes, or we're going to be leaving in 10 minutes. Or here is a list. I want you to take this. I want you to do these things right now. I want you to focus, try to have time to make sure there's enough time to get things done. If they are doing things and it's going to require 2-3 hours of mental effort, we'll say there's going to be some breaks in there. You have to cater to the person's particular abilities and needs. That's part of the thing, Mike. And so many parents really don't. They may have great intentions, but they just don't get it. And another problem with a lot of persons with ADHD, there's a lot of comorbid conditions with them: anxiety, depression, anger, low self-worth because they can't function as the average person. And they often can be mocked, like the class clown or the person who just doesn't seem to get the message, doesn't seem to be listening, can be very exasperating. And it can lead to people giving them a hard time also. So this can lead to other issues and problems for the person. So one thing to do is try to bone up as a parent exactly, well, what is this condition? You don't want to just say, well, that doesn't exist. Well, it does. It does in persons. And if it's channeled correctly, it can lead to really great success. Okay, there are many children that can be helped in terms of medication. There are others that don't need that and just need specific activities, how to do things, training in the home, or very specific interactions with the parents in a positive way. Now, if you can't do this, you can also meet with a trained expert, therapist that can do diagnosis and treatment. But not everybody needs that either. That can be very helpful if you get to a point where the parent just doesn't understand, the child makes the point, look, I just can't focus. I just can't seem to get this done, or it takes me a lot longer to do this, to which the parent always will say, this seems to happen. Well, you're able to do this and you're able to do that. Well, that's true. That's why persons with ADHD, they can be very, very successful when they're doing something that fully engages them, and they can use all this energy, all this time in this way of divergent thinking. But if this is not channeled the right way, it can definitely cause chaos for them, cause chaos in the home. And you talk to teachers and you can see it can show chaos in the school. So the goal here today is just to have parents, if you're aware of these types of symptoms, the lack of focus, the inattention, the not carrying through, and you really do believe your child really means well, wants to do well, your child could easily have this condition and aspects of this condition. And the idea is to try to be helpful. And the child, when we work with children, they will say, well, my parents just don't get it or don't understand. And because often these are really good kids, they just, they kind of get lost. They kind of just go off on their own. And Mike, I'm sure you've known people that the best of people that just seem, when you're talking to them, even if they mean to, they're ready to talk another topic. You can see they're ready to move. They're almost like a rabbit ready to move to the next activity.
You've been talking to my wife, haven't you? You've been talking to her about me, haven't you? Yeah.
Well, it's really quite common, 3-4%. You're talking large numbers, but very successful people can have these traits. It's not like these have to be bad traits. You just have to know how to channel the condition, the problems, the areas you have, and turn them into a strength. Because, no one also wants to be a dull, boring person. I mean, if you can have a lot of energy and move forward, and you're always looking divergently at different activities, different things that can be done, moving forward, it's an exciting life if you can channel it. It's kind of like being a tiger with holding on to the tiger of a tail, the tiger's tail, I should say.
We could literally do a whole show on ADHD and obsessive compulsive and all of that.
That's a whole that's another area. Sure, we can.
Doc,
we've talked a lot of these things.
Yeah. Doc Braccio, Dr. John Braccio, Regional Psychological Services. Every Tuesday we get a little free advice, and we appreciate your efforts there. ADHD. Get a hold of Doc Braccio. Braccio is at BraccioPhD.com. And Dr. John B., isn't it?
drjohnb.com. That's right.
drjohnb.com and find out. All right. Hey, Doc, have a great week, all right? We'll talk next week.
Always a pleasure. Same to you, Mike. Bye-bye.
Thanks, pal. 1320 WILS.